So for those women with hypertension that pre-exists prior to pregnancy, it is important that they consult with their OBGYN prior to pregnancy. And the reason it's so important, we prefer that those women plan their pregnancies. That way, there are a couple things that are critical for those women. One thing that is most critical is that her blood pressures are in good control. Having elevated blood pressures as you start or begin a new pregnancy can put that pregnancy at risk for miscarriage and other complications. Secondly, it is important to ensure that the medications a woman takes when she has pre-existing hypertension are safe in pregnancy, right? And so we don't want her to be taking medications that are unsafe and not knowing. So risk factors for developing hypertension in your reproductive years or your childbearing years could be oral contraceptives or birth control. So commonly, there are birth control that are also safe if you have hypertension. It is very important to meet with your OBGYN or even a family medicine doctor who may also be prescribing your contraceptive to ensure that what you're taking is safe. Also to ensure it is not increasing or causing changes in the blood pressure. So typically, that's why it's so important to monitor blood pressure while you are taking contraception. So as I stated earlier, oral contraceptives can raise the blood pressure in some women. However, before stopping your contraceptive method, again, very important, have a conversation with your healthcare provider, simply to ensure that your contraceptive method, your pills, whatever that may be, are still safe for you to continue to take. I prayed on this question. Okay, I literally had to pray on this question. Okay. What surprises most Black women about hypertension or high blood pressure is the importance of their personal family history. And I mean their immediate family, their mother, their father, their grandparents. And so family history is a significant risk factor that we take into account when we're screening patients for risk of hypertension. The second thing that I think surprises most people are that cutting out red meat, something as simple as that, does not necessarily decrease your risk. So my point here is that sometimes people will simplify the interventions that they can take. And I think it takes a multi-pronged approach when you're managing your hypertension. I'm surprised daily by the things that people continue to tell me that they think will manage and control their hypertension. So one of my first messages I would like to share is don't be in denial. Check your numbers frequently. ReleaseThePressure.com has resources for self-home blood pressure management. And so if you do not know that your hypertension is high, yes, it can be surprising if you visit your healthcare provider to find that you have elevated blood pressure. Secondly, the importance of stress reduction and management. Sleep is another very important factor that people tend to not take seriously. Lastly, exercise. Frequent, regular exercise. Couple things that does, it helps you manage your stress and improves your stress profile. And secondly, it will hopefully help you manage your weight, in which if you gain weight, that could also aggravate blood pressure. So again, it requires a conversation to disclose what your concerns are, and that your healthcare provider can guide you on really what's true and perhaps what's not.